Hello and welcome to Consumer Times, your trusted guide to consumer rights, awareness, and empowerment and education. Today we will talk about pathology tests which play a crucial role in the medical field, helping doctors diagnose, monitor, and manage diseases effectively. These tests involve analyzing body fluids, tissues, and other samples to provide insights into a patient's health condition. Here we explore what pathology tests are, the common types, how they are performed, and their significance in diagnosis. Before going ahead and further discuss, please comment, like, share, and do not forget to subscribe and press bell icon to motivate us. What are pathology tests? Pathology tests are medical examinations that analyze samples of blood, urine, stool, tissue, or other bodily substances. The goal of these tests is to detect abnormalities or changes that indicate the presence of diseases, infections, or other medical conditions. Pathologists, who are specially trained doctors, oversee these tests, interpret the results, and provide critical insights that guide treatment plans. These tests are often categorized into clinical pathology and anatomical pathology. Clinical pathology focuses on laboratory analysis of bodily fluids like blood and urine. Anatomical pathology examines tissues and organs to identify diseases such as cancer. Common types of pathology tests. Pathology tests cover a broad spectrum of medical needs. Below are some of the most common types. Blood tests. Complete blood count, CBC, measures components like red blood cells, white blood cells, hemoglobin, and platelets to diagnose anemia, infections, and other conditions. Blood glucose test assesses blood sugar levels to monitor diabetes. Liver and kidney function tests evaluate the performance of these vital organs. Cholesterol test determines levels of good HDL and bad LDL cholesterol to assess heart health. Urine tests, urinalysis, checks for signs of infections, kidney disease, or diabetes. Culture test, identifies bacterial or fungal infections. Stool tests, used to detect gastrointestinal infections, bleeding, or diseases like colorectal cancer. Tissue biopsies, a small sample of tissue is examined under a microscope to diagnose cancers, infections, or autoimmune disorders. Cytology tests, pap smear, screens for cervical cancer and precancerous changes. Fine needle aspiration cytology, FNAC, extracts cells from lumps or masses for analysis. Microbiological tests, identify infectious agents like bacteria, viruses, fungi, or parasites through culture and sensitivity tests. Molecular and genetic tests analyze DNA or RNA to detect genetic disorders, cancers, or infectious diseases. Immunology and serology tests assess the immune system's response to infections or autoimmune diseases by measuring antibodies or antigens. Pathogen-specific tests, tests for diseases like COVID-19, malaria, tuberculosis, and hepatitis. How are pathology tests performed? Pathology tests follow a systematic procedure to ensure accurate results. The steps include sample collection, blood sample, taken from a vein using a syringe or through a finger prick. Urine sample, collected in a sterile container, often as a midstream sample. Tissue sample, obtained through biopsies using techniques such as needle aspiration or surgical excision. Other samples include saliva, stool, or swabs from specific body areas. Sample transportation. The collected sample is carefully labeled and transported to a laboratory under controlled conditions to preserve its integrity. Laboratory analysis. Advanced equipment and techniques like microscopy, chemical assays, culture methods, or genetic analysis are used to examine the sample. Tests are performed by qualified lab technicians under the supervision of a pathologist. Interpretation of results. Pathologists interpret the findings and prepare a detailed report that highlights abnormalities or significant markers. Reporting to physicians, the test results are shared with the patient's doctor, who uses the information to diagnose or manage the medical condition. Importance of pathology tests in diagnosis. Pathology tests are indispensable in modern medicine. They contribute significantly to early detection of diseases. Early stage detection of conditions like cancer, diabetes, and heart disease can improve treatment outcomes. Routine blood tests, for example, can reveal subtle changes before symptoms appear. Accurate diagnosis. Pathology tests provide precise information about the cause and nature of an illness, enabling targeted treatment. For example, identifying the specific bacteria causing an infection ensures the use of the correct antibiotics. Monitoring and managing chronic conditions. Regular testing helps monitor conditions like diabetes, hypertension, and thyroid disorders. Adjustments in medication or lifestyle can be made based on test results. Guiding treatment plans. Pathology results inform doctors about the severity of a disease and the best course of action. Biopsy results, for instance, determine the stage of cancer and guide treatment decisions such as surgery, chemotherapy, or radiation. Assessing treatment effectiveness. Tests conducted during or after treatment show whether the therapy is working or if adjustments are needed. Public health and epidemiology. Pathology tests are crucial for controlling outbreaks by identifying pathogens and tracking the spread of infectious diseases. COVID-19 testing is a prime example of how pathology supports public health efforts. Predicting risks. Genetic and molecular tests help predict the likelihood of developing certain diseases, enabling preventive measures. For example, BRCA gene testing assesses the risk of breast and ovarian cancers. Legal and forensic applications. Pathology plays a vital role in autopsies to determine causes of death in forensic investigations. Challenges and advancements in pathology. Challenges are accurate sample collection and handling are critical to ensure reliable results. Variations in results between laboratories can pose challenges, especially when standards are not uniform. Advancements are automation and artificial intelligence are revolutionizing pathology, improving efficiency and accuracy. Innovations like digital pathology allow for remote diagnosis, making specialized services accessible to rural and underserved areas. Molecular and personalized medicine are expanding the scope of pathology, offering tailored treatment options. Pathology tests are the backbone of modern diagnostics, offering invaluable insights into a person's health. They enable early detection, accurate diagnosis, and effective management of diseases. As medical science advances, the role of pathology in improving patient care and public health will only become more significant. By understanding the types, procedures, and importance of pathology tests, patients can make informed decisions about their healthcare, contributing to better health outcomes. Please don't forget to like, share, and subscribe to Consumer Times for more insightful content that empowers you as a consumer and gives you information about various subjects.